Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes of a barrel chest. Barrel chest is a rounded, bulging chest that is similar in shape to a barrel. While not technically a medical term, the term barrel chest is often used by healthcare providers to describe a physical characteristic consistent with cases of late-stage emphysema, in which the chest may become fixed in an outward position. Barrel chest can also occur with cystic fibrosis, severe asthma, and other health issues. /r/n/r/n Barrel chest is not usually painful. It is a sign of severe underlying lung disease or damage, so the symptoms generally relate to the cause. /r/n/r/n Symptoms and signs often associated with barrel chest include /r/n/r/n Barrel chest looks like someone is taking a very deep breath and holding it. The person's chest appears rounded and enlarged from front to back and from below the neck to above the abdomen. /r/n/r/n Barrel chest occurs when the lungs become chronically overinflated, hyperinflated, with air, forcing the rib cage to stay expanded for long periods of time. /r/n/r/n Over time, the distention of the rib cage will affect the anterior, forward-facing, chest wall and the posterior, back-facing, wall. Muscle wasting often develops in later stage emphysema. This leads to a loss of external support that further leads to deformity. /r/n/r/n Lung damage and lung disease are the typical causes of barrel chest in adults, but aging can also lead to barrel chest. So can other genetic and environmental factors, many of which are not fully reversible. /r/n/r/n Exceptions include children who have cystic fibrosis or severe asthma. In these cases, barrel chest may be somewhat reversible. /r/n/r/n Emphysema is one of the two diseases that comprise chronic obstructive pulmonary disease, COPD. It may be accompanied by chronic bronchitis, an inflammatory condition characterized by narrowing of the airways and excessive production of mucus. /r/n/r/n Emphysema specifically refers to the destruction of the alveoli, the small air sacs in the lungs at the end of air passages through which oxygen is transferred to the blood and carbon dioxide is exhaled. As the condition progresses, the lungs will tend to remain in a hyperinflated state, leaving the rib cage expanded. This contributes to the barrel chest appearance. /r/n/r/n Osteoarthritis, also known as wear and tear arthritis, typically affects the hands, neck, lower back, knees, and hips. /r/n/r/n It can also cause progressive damage to the bones and cartilage of the back and thorax. The condition, referred to as thoracic arthritis, is caused by the degeneration of the cartilage and bone of the middle spine. As the joint bones start to compress and rub against each other, the ensuing inflammation can lead to a gradual malformation of the spine. /r/n/r/n The rib cage can develop a splayed, barrel-like appearance that can eventually become permanent if the joint bones fuse in this position. /r/n/r/n Low calcium levels can further accelerate the problem, causing deformity of the sternum and a condition known as dorsal kyphosis, in which the back becomes rounded and hunched. Kyphosis can cause mild back pain and related symptoms, but it can become more severe and affect breathing. /r/n/r/n Cystic fibrosis often leads to kyphosis and other spinal changes in children and young adults affected by the disease. This inheritable genetic disorder triggers the overproduction of mucus, clogging the alveoli and restricting the amount of air entering the lungs. /r/n/r/n Over time, the exertion needed to fill the lungs can cause air to become trapped, leaving the chest in a partially inflated position. /r/n/r/n As a chronic, irreversible condition, cystic fibrosis requires constant surveillance to help clear the lungs and prevent hyperinflation. Exercise may offer benefits, but more research is needed to confirm the benefits of physical therapy in treating kyphosis. /r/n/r/n. Severe asthma is a common cause of barrel chest in children. This is due, in part, to the effects of asthma on the still developing ribcage and chest. /r/n/r/n. Asthma causes the air passages to constrict and narrow. When asthma symptoms are severe, the persistently narrowed state of the air passages, in some cases, persisting even after bronchodilators are used, can trap air in the lungs. /r/n/r/n. As air becomes trapped in the lungs, a child's chest can take on a barrel-like appearance. /r/n/r/n. There are rare genetic disorders for which barrel chests are characteristic. /r/n/r/n. About 15% of children diagnosed with pectus carinatum, which causes a type of pigeon chest similar to barrel chest, will develop scoliosis. There also is a high risk of genetic conditions including Marfan syndrome and Ehlers-Danlos syndrome. /r/n/r/n. Barrel chest is a visible effective disease, so your healthcare provider will be able to spot it with a physical examination. You may also have pulmonary function tests, for example, spirometry, and blood work, for example, a complete blood count and arterial blood gases, to assess how well your lungs are working. /r/n/r/n. However, the approaches to diagnosis can depend on the specific context. Genetic testing may be needed in an infant, for example, or testing for scoliosis may be needed in kids. Because barrel chest is not a disease in itself, your healthcare provider will work to identify the underlying condition causing it. /r/n/r/n. The main goals of treatment are to manage symptoms and prevent further progression. Treatments will vary depending on the cause of barrel chest. /r/n/r/n. In the case of emphysema and osteoarthritis, reducing inflammation and improving breathing is essential. The control of symptoms through gentle exercise, medication, and pulmonary rehabilitation may lessen the appearance of a barrel chest, but these therapies cannot eliminate it entirely. As progressive diseases, their damage cannot be reversed. /r/n/r/n. Cystic fibrosis also affects lung development due in part to recurrent bouts of bacterial infection. As lung capacity decreases, barrel chest worsens and can't be reversed. This is especially true in adults with cystic fibrosis. Barrel chest in children who have asthma will generally reverse once the symptoms are brought under control. /r/n/r/n. For a genetic cause like AT deficiency, treatment can include medication and augmentation therapy with donated AT to slow disease progression. Treatments may be far more complex in children diagnosed with genetic causes for barrel chest, which typically have other impacts. /r/n/r/n. Barrel chest is a clinical sign of several different medical conditions but is often associated with COPD. It usually appears in the later stages of diseases like emphysema and should be taken as a possible indication of severe lung damage. /r/n/r/n. Other conditions that can lead to barrel chest include cystic fibrosis, osteoarthritis, and certain genetic-related diseases. While the condition itself is not usually reversible, treatments are available to address the underlying cause of barrel chest. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.